comments?
Sure. I just have recently, in the last couple of days, have had inquiries from members of the community and residents of the county regarding, I guess, in a nutshell, the function of the Board of Health and the Public Health Department when it comes to local care and perhaps families in the community being refused care at local facilities based on their medical preferences, including being vaccinated or not vaccinated.
Board has absolutely nothing to do with it.
And that is basically what I shared, but I just wanted to make sure you all were aware that I had gotten some inquiries and that I am responding in the correct manner, or if there's any.
So I'm assuming they're being turned down from acute care settings.
Yeah, because of their immunization status.
Right.
So the hospital has a policy that if by age 1 you are not immunized and you've refused to immunize, you will be denied care in the clinic. Now, you still go to the ER, you still go to the hospital and be admitted.
Big trouble.
But you can't go to
the ER.
The clinic for non-emergent will not care for you. That's technically it was a medical staff decision.
Okay.
That is consistent with the recommendation from the American Academy of Pediatrics. I'll just share, was not my policy when I had my own clinic. You know, I believe in vaccinations. I think kids ought to be vaccinated. But I don't think we ought to be the police either. But that's the policy. So if they have questions or comments, that should be directed to the hospital administrator.
And that hospital or healthcare system is ran by a board or a board of trustees?
Board of
The
trustees.
hospital is run by
Elected
elected
board
board
of
of
trustees.
trustees. Yep.
Okay. And then does that board set policy as far as like clinical policy, or does that fall back on administration?
It gets a little murky. So technically the board is responsible for everything that goes on in the hospital. However, Iowa does have a prohibition against the corporate practice of medicine, meaning that a hospital board of trustees cannot interfere with the independent judgment of a clinician as they care for their individual patient. So in that regard to medical policies like that, the board generally defers to the medical staff, that is the collective body of clinicians, primarily physicians, because the mid-levels don't have a vote on medical staff.
Right.
And so that is a medical staff policy decided upon by the physicians of the hospital. I voted no, but I got outvoted, so.
So as a provider there, you couldn't independently decide to serve a family who's not vaccinated because of the vote?
Correct.
He would have to follow the policies of the clinic, otherwise he'd be in violation of the policies of the clinic.
Exactly.
And so that's.
And part of my contract is, I will follow the policies.
Yeah, exactly.
Sure.
It's a terminationable
Yeah,
clause.
yeah. Okay.
So, and that's where, and this is in more rural counties, it does get murky because the clinic is actually within the hospital.
Right.
And
Where other, where in like urban areas, you have clinics that are, their own independent.
Right.
And part of my argument for the fact that, I was previously independent and I would still see those kids, now that I'm at the hospital clinic is the sole clinic provider for outpatient services in the county. If you want to get services in the county, you got one choice.
Yeah.
Earlham's part of
Right.
the health system that follows the same policies.
Right.
So I would say make your voice known, let
Sure.
those people, let them know. My understanding is KCCI called them today for a comment on it, so there may be something on KCCI. It wasn't on the 6 o'clock news, but.
Right. Well, the caveat to that is I was asked about funding, because I know there's some public funding that goes into our hospital, because the municipal
They have
facility,
separate
correct?
taxing authority, however. Yes,
So
it funnels through, but.
Is it county dollars, or is it city municipal?
No, it's county.
It's county dollars, but they are, correct me if I'm wrong, but they are an independent taxing authority.
It's a separate levy, like all the other levies.
Right.
Like the other
It's
schools
assessed-
are eight that are,
It's assessed on every single
Yeah.
parcel.
So,
and there are limits on what they can use that for.
the Board of Health has nothing to do with it.
No.
Yeah, bottom line, that's the response. Okay.
Thank you for bringing that up, Greta. I had people contact me about that as well.
And I mean, I totally understand why people contact us, it makes sense.
Your Board of Health.
Yeah.
They've
Or Board of Health.
contacted, they've contacted the supervisors too.
And so I think it's great that we can inform them of who they actually need to talk to, so.
Anything else?
I think that's it.
Okay. Mandatory COVID vaccination, Susan, do you wanna kinda give the board, the scenario that led to this being there and
So what was brought, when I hired the, homemaker aide, she did not want to have, the COVID vaccination. And so I had reached out to Dr. Daylor regarding that, and my understanding is that the CDC had ended their requirements for healthcare workers to have mandatory COVID-19 vaccinations, so that's why I brought it up.
So we did, and I think the policy was in here, wasn't it?
Yes.
Yeah. So when COVID hit, there was a policy put in place that did require employees to be vaccinated. The question before the board is it appropriate to continue that vaccine mandate? Or do we wanna, follow CDC and end that, just as the CDC has? And what, if any, the consideration I would just put out there is, if you say, nope, we're not gonna require it, okay? Does that, and I'll defer to our attorney a little bit, what risk does that place us at for an employee who chooses not to be vaccinated, goes into a home to see a client who has COVID, gets infected, gets COVID, has some serious consequence or that as a result of their employment with us and are not having that requirement in place? Or what if our employee who's not vaccinated has a minor case, goes into a home with an immunocompromised patient and infects that individual because they were not, our employee was not vaccinated. So I don't know, thoughts you have around that?
That's way beyond my specialty, and that's healthcare.
Oh, sure.
Do that. Know your limits, that's rule number one of general counsel.
Yeah.
Well, I think it'd be hard to prove that they infected another patient because they weren't vaccinated. It'd be a hard
I would see
case.
what other places are doing with that, I mean,
So I can tell you, this is one area where the hospital's a little surprisingly lenient. In that, for example, for influenza, they either require you to have influenza or vaccination. They don't require you to have influenza, vaccination, or if you do not, then you're required during flu season to wear a mask for all patient encounters. And so that would be a potential alternative to us to say, fine, if you don't want to get the COVID vaccine, your choice. But if we know that COVID is circulating in the community, which by the way it is, get positive tests every week, then you have to wear a mask in your interaction with patients. Or we can say screw it, which one? Just throw those out as possibilities. I don't recommend the last course. Thoughts, questions?
I do not think that it should be required anymore, and so I think we
I
should
agree.
have further discussion of what other measures we want to have to, but it should not be required anymore.
Other thoughts, comments?
I agree with that. I do too.
Okay, somebody wanna make a motion then?
I make a motion that the COVID vaccine is no longer mandatory.
Is there a second?
I'll second.
Any further discussion? We don't wanna put any additional parameters on about masking or anything like that, or? The other question would be, where does that fall under our general infection control policy? We might wanna review that and see if it's already covered in policy that way.
I'm sure Susan would be able to look into that, but as a healthcare worker who does go into, people's homes on a regular basis, I can say that if the client has positive COVID, then we can take measures from there. If the staff has tested positive for COVID, I mean, it'd be the same for going in for influenza and colds and every other.
That's why I wondered if our general infection control policy would
I
already
think it
cover.
would probably fall under that.
Cause I think our general policy is if their symptoms are present, then we expect staff to
Yeah.
take necessary
Can you
protections.
send us all a copy
Just
of
make
that
sure that
policy?
that's in there.
Any further discussion? Motion is to end the COVID mandate, vaccination mandate. All in favor say aye.
Aye.
Opposed, no. Motion's carried.